such a long time in coming for me. I'm not sure all of you are so anxious about it, but thank you very much for this opportunity. Again, my name is Beth Ann Schott. I work on a trauma unit that is part of a hospital that sees over 2,000 trauma patients every year, and we have 55 beds on the floor. So we have quite a turnover. About a year ago, I was given the opportunity to participate in an evidence-based practice fellowship, and I had hoped to find a nursing intervention that would truly be nurse-driven, yet something that patients could benefit from and could take with them. One of the educators on our unit, which was somebody who was on my team to review the evidence, had done a project years ago using music and pain, and I wondered if some of that same information applied to anxiety and reducing medication use associated with anxiety. So I don't have a slide for this, but just for clarity's sake, I don't have any disclosures for this, and the objectives I hope that you come away with for this are figuring out how we can reduce the anxiety medication use or dependence for medications on anxiety. I want you to understand that there's a ton of research out there that supports this intervention, and also to be able to discuss the future state of an implementation of a project like this. And this is just one little way that we did it. There are, you'll see that there are a variety of ways that it can be done. This is just how we're going to try it. So let's do an exercise first. I would like you all to think of your favorite song. Imagine yourself sitting in the perfect spot, thinking about your favorite song, listening to your favorite song. Okay, so close your eyes now and imagine yourself sitting on a couch, curled up with a fuzzy blanket, or maybe you are on the porch swing, feeling the warm breezes come by, or on the beach, or maybe you're in the car and you have it cranked up to 10 and you're singing along as loud as you can. Take a few slow breaths now. Be in that moment. What is the emotion that you're feeling right now? You probably have several of them, but what's the one that just jumps right out at you? Okay. Now you can open your eyes here. And what I'd like you to do, I hope this shows up. Let's see. It doesn't look like anything. Okay. It looks like it's not going to show up, but I did have QR code. Since that's not going to work, just shout out. What's that emotion that you had?
Joy.
Joy, confidence. I didn't hear the next one.
Tranquility.
Tranquility, content. What else? I'm happy. Anybody else? Peace. Relaxed. I have a ton of favorite songs. I don't know which, but I love, especially at Christmas time, I love to listen to the canon in D. And I'll just turn that up, and there doesn't have to be anything else going on. And of course, there aren't really words to that. I just feel completely like nothing else really matters at that moment. So what we see from that is that music has a very powerful opportunity within our minds and within our bodies to to positively affect one's emotion. I didn't hear a negative comment. Sometimes people say sad, or sometimes people say depressed. There are some people that like those kinds of emotions with their music, but for the most part, they were all positive comments. But I think that what we also heard was it sounds like it was something that was probably taken away from any anxiety we had at the moment. So let's just look at the background here a little bit. Anxiety is often treated in a hospital setting with anxiolytic medications, Ativan, Atarax, Valium, you've seen them all. Before looking into the existing research, we found that 20% of the trauma patients on our unit took at least one dose of an anxiolytic medication, an as-needed anxiolytic, during their stay. And we measure that over about a month period. The physiological side effects of anxiety are a little complicated. A stay in a hospital can involve many problems, and an overactive sympathetic nervous system can prolong the hospital stay and affect recovery. Anxiety can contribute to many things, like an elevated blood pressure, heart rate, elevated cortisol levels. Each of these symptoms, if not controlled, can disrupt sleep. They can increase the need for all kinds of other medications, prolonging a hospital stay, increase sensitivity to anxiety and pain. And we all know that the longer a patient is in the hospital, the risk of nosocomial infection is higher. And let's talk about the patient whose anxiety level is high and we're trying to care for them. How do you respond to someone whose anxiety level is Eiffel Tower high? Are you able to stay calm and respond with a high emotional intelligence? Or maybe you start to have a short fuse, and even the patients in the other rooms are affected by your perception of that other patient's anxiety. Alternative therapies like massage, medication, and music can also be effective and do not have the side effects like the medications do. So we'll quickly explore some of these. Alternative therapies are great ways to perform distraction therapy, reduces the stress caused by an immediate clinical situation, and it can evoke positive thoughts and foster a calming environment. One of the authors that we've read suggested that music specifically is transformative. Music can be able to take the vulnerable, emotional, and physical state that someone is in the hospital and give them a renewed sense of peace and wholeness. Nursing interventions like music are simple and cost-effective ways to deal with the issue of anxiety in a hospitalized patient. And of course, most patients these days have a cell phone. Many hospitals have inpatient televisions that have at least one channel that's dedicated to music. So that makes ease of access to using it for the patient very easy. Now, before we go too far in this discussion, we're just going to clarify a couple of words. You may have heard of music therapy, but that is a very specific line of work, and music therapy is performed by music therapists who are trained as such. In general, as nurses, we're not music therapists, so we're just going to refer to this intervention as listening to music or music listening. One of the articles we looked at referred to it as music-assisted relaxation. So it's all a bit of a technicality, but we just want to make sure that we're not stepping on anybody's toes.
And now for our dramatic briefing.
On a crisp Tuesday afternoon, 57-year-old Janice, with a heart full of love for her two rambunctious dogs, Buddy and Baxter, set out for their daily walk. The neighborhood was quiet, the sun dipping low, casting long shadows across the tidy lawns. Janice hummed softly, her dog's leashes looped loosely in her hand, their tails wagging like metronomes. This was their routine, their slice of peace, until chaos erupted. As she passed by her neighbor's house, the front door swung open. Mrs. Larson was juggling some bags of trash and didn't notice that her cat, Whiskers, decided to take this opportunity to bolt. The sleek tabby shot across the yard like a furry missile. Buddy and Baxter, their eyes gleaming with mischief, decided it was playtime. With a sudden ferocious tug, they lunged after the cat, yanking on Janice's arm with such force that she felt her shoulder nearly pop. Her feet scrambled for balance, but the leashes pulled her forward, and in a heart-stopping instant, she crashed into the jagged landscaping rocks at the corner of the driveway. Pain seared through her right hip, and as her legs twisted beneath her, and a sharp crack in her chest stole her breath. The dogs, oblivious, vanished into the distance, chasing their feline cries. Janice lay there, the cold crown biting into her back, her vision swimming. She tried to call out, but her voice was just a weak croak. The world felt impossibly heavy. Her body screamed with every shallow breath, and her mind raced with dread. Where were Buddy and Baxter? Were they safe? Were they lost somewhere in the neighborhood, or worse? And her mother, frail and dependent on Janice to sort her weekly pills and to provide her evening meals. How would she manage alone? Janice's heart pounded, not just from the pain, but from the weight of everything she couldn't control. Hours later, in the sterile white of a hospital room, the diagnosis hit like a second blow. A fractured right hip and cracked ribs, surgery loomed, promising a week or more away from home. The pain was relentless, a throbbing fire in her bones. But it was the questions, what she didn't know, that burned hotter. Who would find her dogs? Who would care for them? Who would make sure her mother's medications got taken care of and provide her evening meals? Janice clutched the rails of the hospital bed, her mind a store of worry, her body too broken to act. Patients face many types of anxiety when they're in the hospital, and as nurses, we have the autonomy to help them through this. Now, back to what we found. I had a team of about 8 nurses, including clinical nurse specialists, 2 educators, and 5 other staff nurses, and we read and appraised 15 articles. We used the Johns Hopkins model for evidence appraisal. We labeled 3 of them as level 1 randomized controls trials or meta-analysis with an evidence quality of A. 3 were a level 2 qualitative studies with an evidence quality of AB, and 1 level 5 literature review with an evidence quality of A. There were 8 articles that did not answer the PICO question and 7 articles that did. And the PICO question is, in hospitalized non-ICU adult patients, how does listening to music affect patient anxiety? So why music? Music has long been therapeutic. While music was officially described as a therapeutic invention in the 1940s with the creation of the National Music Therapy Association, we know that many examples of music being used long before Nat King Cole was a gleam in his mother's eye back in the 11th century BC. It was written that King Saul used music to soothe his soul from the harmful spirit. Ancient Greece has a bunch of examples. Pythagoras, known mostly for his theorem in triangles, was also convinced that music contributed to the harmony of the universe and stated that certain tunes and rhythms can calm the mind and the soul. Others in ancient Greece believed that music travels with the air into the body via the ears as a gateway into the soul. The brain processes the sound, which eventually will be transmitted through the body with the blood, and that way it goes through the whole body into each organ, and finally the soul. Aristotle thought that music can be an instrument to balance one's emotional state. And all of that was still 400 years before Christ. Fast forward a millennium. Florence and Clara, absolute proponents of using music for healing. More recently, Dr. Daniel J. Levitin, a neuroscientist, cognitive psychologist, and musician, has written several books on music as medicine. I also found an example of some teenagers in Texas a couple years ago that created a 501c3 to take music into hospital setting for therapeutic healing. And according to their website, it doesn't really look updated, but it's still there. It says they have over 50 chapters in high schools and colleges in several states taking music to patients. Wow. Weren't we talking about the millennials and how great they are? That's awesome. Nurses play an important role in promoting self-care and helping patients to make lifestyle changes that can improve their overall health and well-being while they're in the hospital and after discharge. In this case, music can have an effective role in the physical and psychological and social and emotional and spiritual recovery of our patients. I believe we have an opportunity to think on a very basic level to address the needs of our patients. Answers don't have to come or be complex, or they don't have to be dependent on doctor's orders to be effective. Here are a few anecdotal uses of music that you probably have been exposed to in your current practice. Music is being used pre and post-surgery to reduce anxiety and promote relaxation during procedures like MRIs. Some people are using music in the ICUs to reduce anxiety, which helps to reduce the amount of sedation patients need, which of course reduces the amount of ventilator days, and that comes with the decreased ventilator-associated complications. Just last week, Rachel, one of our night shift nurses, played the top 40 from the 1940s for her 90-year-old papaw who was quite restless and anxious. And they just danced the night away. Just help kind of distract him from his restlessness. You've done that, haven't you, with a patient? Now this is a little off topic, but it's still the use of music in patients. But I read a story of a former ballet dancer who had not been responding to care. Maybe you saw the video. She had Alzheimer's, but when they played Swan Lake, it bypassed her impaired verbal memory, tapping into the procedure or muscle memory that she had stored in her basal ganglia. And that kind of explains why she didn't respond to talk therapy or meds, but she just got up and danced instinctively. Studies like those in the 2019 Lancet meta-analysis support this. Music evokes visceral responses in Alzheimer's, and often more effectively than other stimuli. We have a very powerful resource that we just need to harness it for our patients. All right, so let's go into kind of what we found. The articles had multiple themes across the board. They all showed a significant reduction in anxiety levels as measured by Visual Analog Scale, a STAY score, HADS, PSS-10, GAD-7. These scores were measured at different times. Maybe it was on admission, maybe it was discharge or pre and post intervention. They were clinically meaningful. For example, in one article they used the STAY score and they described a difference in pre and post assessment of 2.5 points. I don't use that score, so I'm not really sure. I'm just saying what the literature brought to us. The researchers in each article showed a statistically significant difference in the amount of anxiety when compared to the control group of not using music. Most of the articles had a p-value of less than 0.001. And interestingly enough, there was one article that looked at 3 intervention groups, using music, using massage, or using both. But the numbers in the both group didn't show increased effectiveness of the dual therapy. So one or the other, but both really didn't seem to change. That was kind of interesting. Now, music was delivered in different ways in each of these articles. Sometimes it was via headphones, sometimes it was in a group setting, sometimes it was a music therapist playing live music for a single patient in the quiet of their hospital room. And sometimes it was actually ambient music in throughout the whole ward. In each article, the format, the intervention, and the style of music were different, but the authors all had the same conclusion for reduced anxiety. I did find several notions of other things that they thought were important, but these weren't across the board. A tempo of 60 to 80 beats per minute, which is very similar to a regular heartbeat. The key of G. Authors also recommended minimum sessions of 20 to 30 minutes long, and some proposed 1, 2, or 3 sessions a day. Again, none of that was consistent across the board, but the results of the intervention period is what was consistent. The music specifically, the types of music that they were listening to, were chosen in a variety of ways. Some of it was by the researcher and some of it was by the participants from a short list. There wasn't a consensus, but many of the authors surmised that patients that got to pick their own music would be more likely to enjoy the intervention and more likely to maximize the effectiveness of the intervention. And one final little tidbit that came from a couple of them, they thought that music without lyrics was better suited for this intervention, this type of use. Okay, I think I'm not. Okay, here we go. Results were consistent among all ages and genders that were included in their studies. And one article actually measured the anxiety scale after multiple sessions and found a progressive improvement in anxiety level, which speaks to using the intervention throughout the entire hospital stay. Some other data that was collected from literature stated that music helped reduce, it just says other, you're not really missing anything in that point. help reduce cardiac and metabolic stress, aiding in faster healing, increase patient satisfaction, decrease length of stay, which of course means decreased cost. Music listening can improve patient comfort by alleviating the perception of anxiety with overall improvement of the patient outcome. So now, the moment you've all been waiting for. Practice recommendations. Our work, what we came up with from our work is that it strongly supports using music to reduce anxiety in the trauma patient. Now, none of the articles looked at the variable of medication use, but that's certainly an opportunity for future investigation. And of course, every intervention has limitations, so by no means this list is all inclusive, but but I'm going to give you a few examples. And I don't know if I have this on a slide, so I'm not going to advance it here, but we have all had shifts in the hospital where it's anything but therapeutic. There's noise, and more noise. So that makes it hard for a patient to really focus in on music. Oh, I do. There we go. And then there's the headphones. Not all headphones are created equal. If you have access to noise canceling headphones, that's kind of a game changer. My new earbuds, I can't believe the surround sound that I get from them. But of course, that's an expensive option. And if hospitals are going to provide this, or facilities, they're not going to go with the noise canceling headphones, which are really nice. They're going to go with the cheap model because they have to replace it regularly. But anyway, if a patient has them, that's probably the better option. And then of course the patient background. If they have a pre-existing diagnosis of clinical anxiety disorder or something, or preconceived ideas about music as an intervention, that may affect their willingness to participate. And in one of the articles that we looked at, which kind of speaks to the preconceived idea, 21% of their participants said music was no help at all. And I'm like, well, all right, you must not have been listening, or you didn't really want to do it. Because if you don't think that music is calming or soothing, anyway, my team and I agreed that a quality improvement project would be a great way to implement this on our unit. So I was given a grant by the York Hospital Auxiliary to purchase some equipment for this project. That included headphones, which were not noise canceling, they were cheap ones, MP3 players, and a couple of bags to put them in. I downloaded 5 different types of music onto each player: jazz, classical, spa, ambient, and hymns. And I enlisted the help of one of our nurses that has Cricket, so we could label the bags to try to help keep them coming back, so that they were obvious that they were part of our department. The staff education is going to be kind of multi-faceted. We have a daily huddle at 7 a.m. and at 7 p.m. So there's going to be discussion about the project at that point, what patients qualify for this intervention, and what the documentation needs to look like. There's also going to be an email with frequently asked questions and how to do the documentation. We created a log sheet for the patients to jot down their when and what type of music they used. An education specialist also helped create a post-stay, or at the end of stay evaluation, so it was on the proper reading level. And we're working on an automatic report through the Epic to help us collect data on the medication use part of this. So So we're hoping that, we can reduce the amount of PRN medications by listening to music. Now, we haven't had the chance to actually implement the YES, therefore we don't really have comparison data to discuss. It was really surprising to me how complicated getting the money and then getting the people who do the ordering for these little devices. That was mind-boggling to me. Anyway, that kind of put us in a delay, but here we are, we have bags and we're ready to go. But we're confident there will be lots of information to pour through in the coming months. I'm also in talks with the Director of Operations about getting multiple music channels on the in-room televisions, similar to the options that you have on DirecTV or Sirius. This is going to aid in streamline access to the music without the hassle of maintaining, storing, and keeping track of, little pieces of equipment. So here, that's the report, and here's a picture of the bags that we created. So it's a little clear plastic bag, it fits the MP3 player, it fits the headphones, it fits the log sheets and a pen, and it's not going to take up a whole lot of space on our over-the-bed table, so we're hoping that is an easy way to keep track of of our equipment. So back to Janice, real quick. Yes, she had immediate needs, which we addressed, but I think she could have benefited from listening to music as she sat in the hospital with all of her racing thoughts. That night, the primary nurse was able to catch up with the care management nurse who was to address some of these other issues that she had. He found out that Mrs. Larson, the cat neighbor, was able to, set up temporary visits for Janet's mom, making sure her meds and her meals were taken care of. And the young family next door was able to take care of the dogs. So they were giving the dogs lots of playtime and treats, so they were taken care of. I have one last quote to give you, which I think kind of sums up embodies the challenges we often face in nursing, by Margaret Thatcher. You may have to fight a battle more than once to win it. That's all I have. Thank you very much.
Thank you, Jen, for that. Are there any questions from the audience? Oh, okay.
Thank you very much. I'm Susan from Pakistan, and I'm a psychiatrist nurse too, and working as a director in Amma. So my question is that if somebody don't want to use this music therapy, like he don't want, or so what would be the substitute for this? Like we want to use this music therapy for treatment, and patient does not want. So what would be the substitute instead of?
If the patient doesn't want to use the music therapy, is that what
Yeah.
you're saying? Well, then you
don't
have
want
to.
listen music, and
I'm not sure I understand your question. If they don't want to use the music or to listen to the music that you have.
yes. What would the substitute?
Well, the researchers said that patient preferred music is probably the best option. It just wasn't always available. If a patient wants to listen to cultural music that is their passion, that is certainly a good option. Is that what you're asking?
And I told you that I'm a psychiatric nurse. I worked long in a psychiatric hospital, and there are many patients and they were therapy for music too. But some don't want to listen to that music.
Yeah.
So,
Well, so we were looking at patients that didn't necessarily have psychiatric disorders because, as I said, that definitely affects their preconceived ideas or their willingness to participate in that type of thing. But if they're not interested, you have to go down through your bucket of other options of listening of other things, whether it's mindfulness, meditation, or what the Bethany talked
thank
about.
you very much, that's for meditation and
I'm sorry.
other options are meditation and
Meditation, mindfulness, listening to or using aromatherapy or yoga, like she talked about the other day. Yeah, there are definitely other options. We just were honing in on music with this one. What's your question back there?
During your research, did you find anything to correlate with staff anxiety management? Like, for instance, on the unit, like soft music playing or anything like that for the staff?
Well, that wasn't like a primary focus in there, but one of the articles showed music, or their intervention was playing music on the unit some days, and they would survey people there, and they would not play music on other days. And I think they surveyed staff and patients equally. And so I don't remember the difference, if there was a difference with the staff answers, but I think in general, the intervention days were the days that people recorded a lower anxiety. But, yep. Anybody else? Okay, thank you.